Hello, this is Dr. Tyler Hamel, a chiropractor in Kingwood. Today I'm going to explain a little bit about chiropractic treatment for sciatica. If you're looking for sciatic treatment in Kingwood, Texas, then please pay attention to this video. My name is Dr. Tyler Hamel. I've been a chiropractor for over 18 years. So I'm going to explain a little bit about what sciatica is and then some stretches that can help alleviate some of the pain that you have from sciatica. So the sciatica nerve, it goes down basically each cheek on each side. And initially the nerve comes from the low back in this area here. So if you take a look at this poster, you'll see the spine comes down here, the low back is here. When the nerves come off of the low back, basically they'll come back on each side, and part of that splits and goes down into the sciatic nerve. So when you have sciatic nerve pain, which usually is, it could be a combination of back pain, pain in the buttocks, sometimes all the way down the leg, sometimes numbness, tingling down the leg, or weakness down the leg, then it can be coming from the low back area, pinching of a nerve, or it can be coming just from extra pressure on the sciatic nerve itself, and that's usually caused by hip issues and tightness in the muscles around that area. So as a chiropractor, how do we know, how do we evaluate sciatica? So first we're going to do some tests to look at, is there any kind of spine and nerve irritation happening in the low back that might be causing problems with the sciatica. So if you look at this little scan over here that we do one of these on every patient. So we're looking for spine and nerve irritation. As you can see in this one, this particular patient does have pretty severe spine and nerve irritation on the lower back, kind of L5, S1. And that can certainly give the kind of sciatic pain that people would have. So how does that happen in the first place? So usually from postural stress, any kind of accidents or injuries, also that can play a part in it. So here's a couple of stretches that you can do to help with the sciatica. Okay, so number one, we're going to do the lateral hip rotators here. So you're going to lay down on your back on the table. Whatever side you're stretching, you put that ankle over the opposite knee, and you're going to grab underneath here and pull, and make sure your head stays down, and you're going to pull directly back. You should feel this stretch on the buttocks on the left side right here. You're going to try to hold that stretch for at least a good minute. If you're feeling some kind of pain or discomfort or numbness, tingling in that area, that's okay. That's pretty normal when we're stretching the muscles around the sciatic nerve, because we're right on top of the sciatic nerve, so that can give you those kind of sensations. So I would do that daily, a couple times a day. Again, hold it for at least a minute, sometimes even a little bit more if you can. And the second stretch we're going to do, number two, the hamstring stretch. So I want you just to stand up on a table like this. Make sure that your feet are pointed towards each other. So they're going to be basically facing towards each other. And from the hip here, all you're doing is leaning over, leaning down, keeping this leg straight, and you'll feel a pretty good stretch down the back of the leg. Again, we're stretching the hamstring. It's a really big muscle, but the nerves are underneath it. So when you're doing that, you might feel some pain or numbness, tingling all the way down the leg. The hamstring's a really big muscle, so we want to stretch this one for all the way up to 4 minutes. And you can do this either on a table, you can put your foot up on the wall. The key is to keep your legs straight. Just keep breathing through it. Okay, so number three, we also want to look at the front part of the leg, because there's always a balance between the front and the back. So we don't want to neglect the front part of the leg. So a simple stretch we can do for quad and hip flexor is stand up against the wall. We want to bring the heel to the buttocks. Right, so we can pull straight back like this, and at the same time we can push our pelvis forward. Thinking about pushing the pelvis forward, and that'll help the hip flexors feel a little bit more of the stretch as well. So it looks like this. We're pulling up the leg, heel to the butt. We push the pelvis forward. Again, we want to hold this for probably a good 1 minute, because that's another muscle that's really, really tight with sciatica. So, again, I'm Dr. Tyler Hamel. What we do on the chiropractic side is we adjust the spine. Like I had mentioned, we look at spine and nerve irritation. So we want to adjust those areas to correct the problem. Right? We need to take pressure off the nerves of the low back to help healing of the sciatic nerve. And we do that through chiropractic adjustments, a series of chiropractic adjustments. That, in combination with the corrective exercises that I showed you, usually can alleviate sciatic nerve pressure in as little as 3 visits, sometimes 6 visits. But you don't necessarily have to come to see me right away. Try these stretches on your own. If that alleviates some of the sciatic pain, then great. If not, if you're still having some issues, it might be a little bit more complex than that, and I can do an evaluation on you. So if you want to come in for an evaluation for sciatic pain, if you've been struggling with it for a long period of time, maybe you've taken medicine, maybe you've done other therapy and things just aren't working, then please give us a call, 281-360-8387. If you learned something today about sciatica that you didn't know about, please like the video, share the video, tag somebody in this video who you know is having sciatic pain, basically pain in the butt. If they're sitting down, they have a lot of pain in their butt or numbness down the leg. Sometimes with people, when they get out of bed, they have a lot of back pain. When they step down, they can hardly step down because of the pain from the sciatic nerve. And I'm Dr. Tyler Hamel. Thanks for watching this video. Our number 281-360-8387. If you're struggling with sciatica or sciatic pain and looking for sciatic treatment in Kingwood, please give us a call.